I also wanted to talk about TrueBeam and HyperSight. Actually, HyperSight is our new imaging technology that we have across all our platforms now, including Ethos, which is very, very exciting because unless you can see more precisely, see what you are treating, you cannot adapt as precisely.
No.
So having HyperSight on our Ethos platforms, our TrueBeam platforms, and our Halcyon platforms really takes imaging to the next level and hence patient treatment and precision to the next level.
We're excited to speak about new possibilities and capabilities at Varian machines. So, can I ask you about what's the new features of Varian machines now you have, and what's the future upcoming capabilities your systems gonna have?
Excellent question. Because we as Varian, we have just combined with Siemens Healthineers and we are working to transform cancer care along the patient journey. One of the first ones is AI contouring. In that space, we have talked about detecting multiple METs and not just organ at risk, but also targets. So please
That's
feel
new.
free to come and see that. So today we have been, of course, able to look at organs at risk, but we cannot detect targets automatically. Now we have released that in the brain. The second big innovation that we have released is RapidArc Dynamic. And that is going further along in that patient journey on the treatment planning aspect. And that is all about really addressing the limitations of optimization that we see today from today's techniques like VMAT or RapidArc and IMRT. With RapidArc Dynamic, we can really reduce the dose to organs at risk, hence reduce the toxicity that the patients get.
Which type of the patients will receive the most benefits out of Dynamic RapidArc system?
So today, the most data that we are seeing is for breast patients, but we've seen a huge amount of information on benefits for head and neck, mostly all indications. In fact, what our early adopters are seeing is that every arc matters. So they are seeing a lot of efficiency, not just in planning, but also in delivery time. And they're seeing a lot of dose reduction to your heart, to your contralateral lung, and therefore to reduced organs at risk doses.
Okay, what about multi-target MTS cases?
So multi-target cases that we talked about, we can also see low dose spill. So the information we were seeing is from VMAT kind of techniques. We used to see a lot of low dose between targets. With RapidArc Dynamic, we can reduce this low dose spill even further. And we can reduce the dose to this midline structures that has always been challenging for like esophageal cases, for head and neck cases.
What you can tell us about adaptive treatment planning and adaptive treatment?
So adaptive treatment is a huge big step today in personalizing radiation. I think that is pivotal. It is vital to go towards adaptive. And for that, our Ethos platform really has taken the next step in the paradigm shifting modality. Because today, to do adaptive, most centers really shy away from having to do because of the cumbersome workflows, because of the challenges with going from one aspect of the workflow to the next. With Ethos platform, we can really treat within a standard time slot of 15 minutes. And what was the real challenge in the first version of Ethos was the separate island. Now, with the version 2 that we have just released, we are talking about an integrated solution. So we can really have ARIA coexistence with Ethos. We have an improved optimization engine. So our plans are much better in quality and much faster in planning time also.
So am I correct that we don't have to expect much higher time treatment with adaptive planning and treatment comparatively to normal fractionation?
A little bit of a learning curve in the starting. Maybe instead of the 15-minute, you may see a 20-minute slot. But as your department becomes more experienced with doing that, you will be able to get that time for your standard treatment slot for sure.
Thank you. Sounds impressive.
Very impressive indeed. And thank you very much for your time and for talking to us today.
Thank you as well.